Hi everyone, this is Neel Raithatha, consultant audiologist and director of WAXscope. Thank you for joining me in my latest video using the WAXscope. And here we have a really interesting case. It's of a patient who's only just turned 2, and they attended with their mother and grandmother, and I'll just give you a case history summary. So they've had problems with their ears, particularly this left ear, which they've been finding very itchy since the age of 6 months. And they've been backwards and forwards to the GP, and they eventually got an ENT referral, and they saw ENT back in November 2024. At that appointment, however, this wax, or actually it's dead skin, it was too hard for the ENT to remove. So they requested that the mother instill some softening drops and then return a week, I think a fortnight or so later. However, the patient then got ill, so they had to cancel the appointment, and then it's been really difficult for them to rearrange the appointment, and they've been told they're going to have to wait months again. So the patient's mum was searching for someone who can help, and not many audiologists actually treat pediatric patients, and they came across a YouTube video of mine, and they discovered that I was also based in the same town or city, Leicester, and so they brought the patient today, and it was extremely challenging because bless this poor child, they were crying so much, they were almost screaming. I actually developed some tinnitus after the procedure because they were crying so much. And both the mother and grandmother were trying to keep the patient still. And you can just see at the entrance how tender and sore this patient's ear is. Also, they are experiencing delayed speech and language acquisition. We don't know whether that's due to this wax or if there's other problems there. But the first port of call, obviously, is to clean their ears. Now, I can just about see the eardrum. It's really tricky. Now, the eardrum was intact. It did look a bit dull, and it looks slightly retracted, but when I performed tympanometry, which is a middle ear assessment test, both eardrums were fine. They had normal middle ear function. So I've referred back to the GP because they do have superficial otitis externa, so like eczema of the ear, for example. They do have an allergy, and we don't know whether that's leading to them having this problem inside their ear. But although we've cleaned the ear, that was going to give the patient some relief in terms of scratching and itchiness, but if we don't treat the cause, the skin is just going to come back. So this is just dead skin that's being produced by the ear and then shedding in the ear, and then it's an accumulating in the plug. And what I've done in the video, I've not edited anything. I'm showing you all the bits where I've had to come out and all the difficulties I've had. There were some parts in the first ear and also this ear where the patient was wriggling so much that I had to come out the ear immediately. There was one part in the first part of the ear, this is their right ear, so they're in their left ear, where the patient managed to escape the grasp of their mother and grandmother, and managed to actually get their hand on the WAXscope. So as soon as they did, I came out the ear. And this is where the WAXscope is really, really useful. So with an endoscope, although I would have managed to do the procedure, with the WAXscope, with the specular, you do have that solid foundation. The specular is there as a support mechanism. There's just a bit left here. So the right side, they were experiencing less symptoms, but because the patient was here, the mother was very keen to have this also removed because they were worried it's going to get build up. So just going to look inside the ear. Now there's bits and bobs around the edge. We're not going to be cute. This child's 2 years of age. So it's tricky enough as it was to do what we have today. So again, the eardrum is dull. It is retracted as well, but middle ear pressure testing was fine. They do get water in the ear, so I've explained the importance of avoiding that water because the water could be the trigger of this otitis externa. Well, I hope you enjoyed that video, guys. Take care, keep well.